Hello, I'm Lorraine Govender and I'm from the Cancer Association of South Africa. Today with me, I have Marisa, who is a breast cancer survivor, and she's going to talk to us about her journey. We want to thank the Saturday Star for the opportunity to talk to you today about something so important like breast cancer. Marisa, thank you for the opportunity to share your story with our viewers and listeners today. To start off with, I would like to find out, how long have you been living with breast cancer?
Hi, Lorraine, and thank you very much to CANSA and the Saturday Star for the opportunity to talk about breast cancer, which, as you say, is such an important thing for women and men in South Africa. I was diagnosed with breast cancer in August 2019. So I've been living with breast cancer for 2 years now. I am blessed to have found out just now, recently in August, that I am in remission. So I'm really thankful for that. But it's been two crazy years of treatment, a lot of emotional ups and downs, financial ups and downs, and yeah, it's a life-changing experience.
Thank you. So you touched on something that's quite important. And, we often talk about the emotional aspects of having breast cancer, but you spoke about the financial aspect. And I think if you could just touch a little bit more on that.
Lorraine, it's still so fresh in my mind, just thinking 2 years ago. So what happened is every year I go for annual checkup, because we have some family history of high blood pressure and other health issues. And I decided it's time for a checkup. Went for a checkup. I had my clinical breast exam done, and my GP told me that I'm healthier than 95% of other women my age, which was 45 at the time. And 2 weeks later, I went for my first screening mammogram. And I walked out of there with a report that said 85% chance for malignancy. And that was a huge shock. I am a freelancer. My husband is a freelancer. We do not have a medical aid. We only have a hospital plan. We're not people with life insurance, because as a freelancer, you can't afford all those kind of things. You need to live on the cash you have. There's no such thing as accounts or credit cards or anything of that as a freelancer. And, it is I remember going home and finding out that a biopsy costs between 8,000 and 15,000 rand, depending on where you have it done. And that for me was the start of a financial journey that really was a difficult one to go through, because I sat with this thing of, what do I do now? So I must go for a biopsy to confirm, is it breast cancer or not? I sat down with my GP and I said, what's going to happen if I just pretend this never happened and just forget about it and just move on? And his words to me were that then you can get your will and testament ready. And that sort of was the thing that made me think, what is it that I need to do? And I then had to literally go and look at all my options. I realized later that my hospital plan has an oncology benefit, which was a great blessing and advantage, but still it doesn't pay for everything. I had to start a crowdfunding campaign to just help me pay for some of the treatments, because what happens now is, even though the hospital plan pays for it as a screening and prevention benefit, I still must pay for everything up to the time it is confirmed that I'm diagnosed. And that's quite a lot of money. So the financial impact is huge if you do not have a medical aid, if you don't have life insurance, if you don't work for a salary, where you don't have a fixed income. And even if you work for a salary, I mean, the majority of the people in South Africa live on minimum wages. So how can one expect someone who has a minimum wage income to pay for breast cancer treatment? What scared me the most is when I eventually got to see after I received the diagnosis that says, now it's confirmed you have breast cancer. That was, let me think, I was diagnosed in August 2019, and by October 2019, I had it confirmed. I have breast cancer, stage 2, grade 3. So I knew exactly what was happening. I sat in front of the oncologist, and he said there's one thing that he's unsure from the histology of the cancer is whether my cancer is HER2 positive or not. And I asked him, what's the difference? He said, if it is HER2 positive, it's going to cost you R500,000 for treatment. My husband and I went home and we were in a flat panic. And eventually it came out it was HER2 positive. And I almost stopped my treatment. We had to sell our car. We had to sell some of our personal possessions. And it was really difficult. I had to borrow money from family. At the crowdfunding campaign, my friends and my followers on social media, because I was active and public about this right from the start, they actually contributed a lot to my treatment. Without them and without the care and the people around me, I would never have been able to actually get treatment. And that I'm really thankful for.
Thank you, Marisa, for sharing that. I think you're touching on something that is so important. And just to share with people, HER2 positive breast cancer is quite a difficult cancer to treat. However, we're quite excited from the Cancer Association and other cancer organizations. We've fought a long and hard battle to ensure that Transumatab is now on the essential medicine list in our country. So now, breast cancer patients can actually have access to this life-saving treatment in the public sector. So I think that's really important for people to understand. If you just look at the difference between, in terms of the price and the costing of it, the availability in the public sector and the costing in the private sector, there's a huge difference in terms of that. And it's good to know that it's now available to our people in our country. It's very important. You also touched on something else, the emotional support, the emotional impact of living with breast cancer. And you were very fortunate that you had the support of your family, your friends, to take you through this journey. And a lot of our people out there don't have that. And sharing your experience now, with people allows others to see how important it is, number one, to talk about your cancer journey, to talk to people about the fact that you have a cancer diagnosis. Cancer can be beaten and treated. So don't keep it to yourself. Tell others that you have this so that you can get the support, because a lot of people still associate cancer with a death sentence. And you now telling us, that shouldn't be that way. I also want to tell people that, there's a lot of support groups out there, being run by the Cancer Association, and I'm sure you're going to talk about that just now. And also people needing to access the public health system. The Cancer Association has a list of breast clinics on its website, so they can also look on our website for further information. So I just want you to touch a little bit more in terms of what was it like for you living through your cancer disease?
Lorraine, it is something that I said earlier on, that when my GP told me, when I asked him what's going to happen if I just ignore this, in essence, at that time, it felt like a death sentence. So that's the first thing I want to say. It is not. I realized as I educated myself about my diagnosis that it is not. It can be beaten. There are so many women out there who has been living with breast cancer, who survived breast cancer, who are breast cancer survivors. And you talk about support groups. Sorry, I'm going slightly off your question because I just want to bring the importance across. I did not know that when you are diagnosed, you can immediately register with hospice. You don't have to wait for end of life to register with hospice. And for someone who does not have the emotional support of friends and family that I had, that support you can get from hospice is also so important. And I think that that's something that people must not forget. Even if you feel like you have no one to support you emotionally, there are people to help you. Reach out to CANSA, reach out to the organizations that works with cancer, and make sure you get the help you need. Talking about it is definitely one of the most important things. And I talked about it openly right from the start, but I only realized 2 years down the line when I went into a really bad depression, really bad, that I need to talk to someone professionally. And that professional help is available even if you do not have a medical aid or if you have no income. That help is available. I don't want anyone, no matter what illness you have or what your situation is, and this goes wider than breast cancer. I don't want anyone to ever feel that they can't speak to someone because there's so many people who you can talk to. So that's the first thing. And then talking about living with it, it's really, it's not easy. It is, even though you have people around you, you feel alone every day. The person that I knew as myself disappeared. The energetic person that I am just wasn't there anymore. And I got depressed because I didn't recognize the person in the mirror in the mornings. And I didn't recognize the individual I became being lethargic, getting body aches and pains I've never in my life experienced before, because the treatment is tough on the body. And the surgery is tough. I underwent a bilateral mastectomy as the first step in my treatment, which is not the usual way oncologists normally treat it, but I just decided that is what I want to do. And that's the other thing. You have treatment options. You have, and it's my body. It's my right to choose my treatment. If I listen to someone and they tell me this is the treatment that I recommend, read up about it. Educate yourself before you make a decision. Ask questions. I think that's, if I didn't do that, I think the 2 years that I've been living with breast cancer would have been so much more difficult. And there is no right or wrong choices when it comes to following your team's treatment plan. Just do what's right, what you feel is right for you, and get treatment. I think that is the important thing. And then COVID was there. I had several surgeries. I had some complications. So I had several surgeries, and my husband could be there for the first one because it was in September 2019. So that was before COVID hit. He was there when I woke up after being in hospital. It was my first ever hospitalization. I've never been in hospital before in my life. So that was quite scary. I had no idea what to expect from anesthetics, nothing. And every single surgery thereafter, he had to drop me outside. I had to go in. You were alone. Most of the hospitals, I understand, didn't have wards because of the danger of COVID. So people were also isolated within the hospital. The first time I was in hospital, I was in a lovely ward with lovely other ladies. I made friends in hospital. It is, I made friends 2 years ago that I'm still in contact with in hospital, who were also there for breast cancer surgery.
Yeah. Thank you, Marisa. I think you touched on something that is so relevant. You spoke about contacting hospice. You're touching on palliative care, and it's important for people to understand that palliative care doesn't start at the end of life. Palliative care starts from supporting a patient from the time of diagnosis. It's important. I think it's extremely important, when you have a cancer diagnosis, or even when you are unsure about something in your body, to reach out to cancer organizations like the Cancer Association or hospice or other organizations, like, to confirm things that you need clarity on. You were fortunate, you were able to go for a mammogram, but there's a lot of people out there who don't have access to that. And we at the Cancer Association, we have an advocacy department, to assist people, to facilitate further screening and support. So don't be afraid when you're not sure. Reach out. There's a lot of organizations out there to support people. So palliative care is extremely important in supporting people, once they are diagnosed with cancer. Something else, you spoke about counseling, and the Cancer Association, you spoke about COVID as well. And we were very lucky through funding that we have to actually set up a telecounseling line. So even if you're scared and you can't go to a support group or access services physically, we have a telecounseling line that people can access. And all of that information is on the website, and I'm sure it will come up on our screen later on, so for people to please take. And you spoke about the isolation that people are faced with, and have experienced during COVID. And we picked that up as well at our Cancer Association, because we have care homes. And during this time, during the COVID time and during lockdown, our patients prefer to actually stay in the care home. Like you said, you went through treatment centers and you got support. Our patients in our care homes actually felt so much better staying in the homes during the 6 weeks, because they got comfort from each other. And so, it's so good to hear that from you. You got that when you got to the treatment centers, and our patients in our care homes have a similar support, therapy when they stay in our care homes. But I want you to talk a little bit about how COVID impacted you as a person in terms of accessing services and things like that. Thank you.
I think the scary thing for me about COVID was we live in a beautiful little countryside town called Parijs, and it's on it's near the Vaal River, so it's close to the border between Gauteng and the Free State. And I opted to have my treatment done in Johannesburg, and the scariest thing for me was going through the border patrols for treatment, because I was busy with weekly chemo at the time when COVID hit. When COVID became a big thing, I was diagnosed, as I said, September 2019. By January 2019, when the world started talking about this new virus, I decided to start self-isolating immediately, because it spoke about comorbidities and how dangerous it is. So I immediately started self-isolation. Thankfully, I'm a freelancer, so I work from home. So that was the one positive about it. It wasn't that I couldn't go to an office. I could still work. I was still at the office. I could still serve my clients. I could still do my work. And I think that the most difficult thing was to not see friends for me from a social perspective in COVID, because although I could possibly have seen them, I didn't want to until I got vaccinated, because it's my life. I only have one. So I really, really took myself out of society. And that was not easy, because my husband and I don't have children. So it's just the two of us in the house. And it's difficult on the relationship. A cancer diagnosis is difficult in any relationship. Then came COVID, which made it more difficult, because now we're both at home. And the frustrations were really not conducive for positive thinking patterns, if I can put it like that. I have a blog, and I wrote, one of the articles I wrote was about those deep, dark thoughts. And that's what happened with me during COVID, during lockdown, because now I'm a cancer patient. The medication is making me feel crappy. Um, I can't go anywhere because we are in lockdown. I can't see my friends. I only have my online friends to rely on. And during the day, I'm fine. But at night, when the lights go down and it's all dark, then the mind goes all dark. And I think COVID just amplified that times 20, because you feel more alone than you would have, in my opinion, if it weren't locked down. So COVID was not good for, I think, any person with any kind of comorbidity from a mental perspective.
Okay, thank you, Marisa. And you touched on something. You spoke about the night. And the Cancer Association, I'm not sure if you've been to any of our Relay for Life events, and it's an overnight event. And it definitely talks about what goes on in the journey of a cancer patient or survivor at night. When the sun sets, that's when, the dilemma starts and your mind starts playing games. And so it's a very good event. And, people can, if they're survivors and people who are interested in supporting our Cancer Relay for Life events, they will experience that journey that you talk about right now. Thank you for touching on that. And I hope we're going to have more people that will be at our events to experience what you talk about. So it definitely, the COVID situation, we also had situations where people couldn't even come into the metropolitan areas for the treatment. We were busy writing out letters and, allowing them to come for treatment. So it was it was difficult, and now you have to tell everyone else, total strangers, what you're going for cancer treatment, and maybe you're not ready to share that. So definitely COVID had that impact. And also in terms of screening, we found a lot of people weren't coming in for their clinical breast examinations or the pap smears. And so do you, prior to this, did you do clinical breast examinations or self-breast examinations? What is your message?
So I have always feared breast cancer. And I have always done self-examinations. That is something I actually did weekly, religiously. Every week I would do a self-examination. And when I go for my annual checkups with my doctor, we do clinical breast exams. So for me, having then gone for a screening mammogram and found the cancer early was a big shock. But I think it was also a blessing in disguise, because had I left it until my next clinical examination, treatment would possibly have been more aggressive than it was. That's actually, sorry, if you don't mind, we could just quickly talk about that. That's the other thing. The treatment regime is not set in stone. Because I remember when I actually saw a second oncologist for a second opinion. And what she then did is, I told her my lifestyle as a freelancer cannot afford to go for chemo and be out of action for 3 days before I can work again. And I have 2 friends who's gone through cancer journeys as well, not breast cancer, but cancer journeys. And I saw what chemo did to them. And I had them as support as well. And when I asked them about chemo, both of them said the first 3 days after chemo, you can hardly do anything. And I told my oncologist that I just can't function like that. And she then said, then we give you a different treatment regime, a shorter infusion once a week. And my side effects were much less. And I was really blessed to not have terrible side effects. So that's the other thing. Once again, it's your body. Choose the treatment that's right for you. But then going back to the self-examinations, that is definitely something that we have to do. We must understand what a normal breast looks like. One must understand that what are the early signs that you can yourself spot on your breast. if I remember right, it's a lemon skin is one of the things that could be a potential indication that it could potentially be breast cancer. I mean, any lump needs to be checked out. I actually had a lump checked out in 2017, but it was a benign cyst.
Okay.
So and they disappeared. I went for my checkup 6 months later, and they disappeared. So I was confident that I'm fine because I've been doing all these self-examinations, and also there's no family history of breast cancer in my family, none. And
So,
I did.
so that's very important to note, because people often think, you know what, I don't have a family history, there's no genetic history of breast cancer, so I'm safe. And it's a misconception.
I mean,
So I think
a family history must start somewhere. And ironically, I mean, sorry, I'm laughing about it, but ironically, my second cousin on my father's side was diagnosed with breast cancer beginning of this year, end of last year, beginning of this year.
okay. So
So
this
there's
is much later.
So
Yeah.
there is another breast cancer in the family.
That's coming up
After
now.
after I actually said that, because I immediately let all the family know, please check, please go for your clinical breast examination. And I also think another important thing is, when we are in October, we are in Breast Cancer Awareness Month. It is not, people don't only get diagnosed with breast cancer during Breast Cancer Awareness Month, So one needs to be aware that throughout the year, there are places that you could go to actually have your clinical breast exam done by a professional. I mean, I know CANSA offers the service. There's so many other non-profit organizations that go out into communities even, so that people can have access to a clinical breast examination. And I know more of them happen in October, but they happen all over. And people need to know they have access to those clinical breast examinations.
Absolutely. And Marisa, you often, when we go out and talk to women and educate people on, how to do a self-breast examination, it only takes 5 minutes. You could do it in your shower, you could do it anywhere, but it's important to do it. And if people are not sure, they can look at our website. We have a wonderful video that teaches women on how to do a self-breast examination. And what you mentioned earlier on is, you were doing those examinations and you didn't really pick up your lumps. So that's the other thing women need to take note of. You may not immediately feel it, but if your body talks to you and there's something not right, please go and have an investigation. And again, you spoke about the quality of life. So women need to understand that when you go on treatment, you can still continue with a normal life as much as possible. You still manage to work. Thank you, Marisa. I know we're running out of time, and gosh, there's like so much that you are sharing today, and it's really, really so informative to hear from a survivor on their experience. I want to what is your message to people out there? Number one, to the public, to the government. Thank you so much for sharing your journey with us.
Thank you so much for having me, Lorraine, CANSA and Saturday Star. I think the most important thing, firstly, I want to thank government for everything they do to keep our excellent public health breast clinics out there. The public needs to know that, I think women need to know that they shouldn't be afraid to have their breasts examined. I speak to so many people who say, but I don't want someone else to touch my breasts. Yes, our bodies are ours, but it's important that you have a professional look at it. Remember, the professionals are trained. They know what to do. They know how to make you feel less scared and more comfortable while they are doing the breast examination. I speak to so many women who say, but I don't want someone strange to see my breasts. I don't even look at my own breasts. How can I let someone else look at them? And I think that's a cultural thing that we need to get over. Because it is something that we need to look after our bodies. And in order to look after our bodies, someone else must be able to, we must allow the right people to examine our bodies so that we can remain healthy. And cancer is not a death sentence. You can live a long life after it. And it's not easy, but it can be done. So thank you very much for the opportunity to share with the public and to women to know that there's life after a cancer diagnosis.
Thank you so much. And thank you to the Saturday staff for the opportunity to share this today. Thank you.
To do a breast self-examination, follow these 3 steps. Check for any visible breast changes with your arms at your sides, overhead, firmly pressing your hands on your hips and bending forward. With a pillow under your shoulder, make small circles by pressing down on the collarbone, moving clockwise towards the nipple. With your arms raised, check your breasts with a soapy hand and fingers using the same technique as lying down. Repeat these steps on both sides.